Did you know that the foods you eat could be a game changer for your kidney health? With over 10% of the global population affected by kidney diseases, understanding how your diet influences your kidneys is crucial. But what exactly should you eat to support these vital organs? Keep watching to discover 5 incredible foods that not only taste great but are also beneficial for your kidneys. Make sure to watch until the end to find out how these foods can fit into your daily diet. The importance of kidney health. The kidneys are essential organs that filter out toxins, excess salts, and urea, a waste produced during protein metabolism. This complex filtration system balances bodily fluids and influences blood pressure and various other critical bodily functions. Unfortunately, kidney disease is increasingly common, often progressing silently before symptoms become apparent. The effects of compromised kidney function can be severe, leading to the necessity for dialysis or even transplantation. This underscores the importance of preventive measures, such as a proper diet, to maintain kidney health. In addition to their filtering capabilities, the kidneys also play a crucial role in other physiological processes such as the production of hormones that regulate blood pressure, support bone health, and control the production of red blood cells. The health of these organs is thus intricately linked to the overall endocrine balance and vitality of the body. Early detection and management of kidney issues are critical, as even mild dysfunction can lead to significant health consequences over time. This further amplifies the importance of maintaining kidney health through mindful lifestyle choices and regular checkups. Best 5 foods for kidney health. Today, we'll explore 5 foods that are not only delicious, but also packed with nutrients that support kidney function. Let's dive in. 1. Red apples. Red apples are a powerhouse of nutrients, particularly rich in fiber and potassium, which are pivotal for good kidney health. The fiber helps reduce cholesterol, control blood sugar levels, and promote heart health, while potassium helps the kidneys filter blood more effectively. Moreover, apples are a low-calorie snack that can keep you full and satisfied, making them an ideal choice for maintaining overall health and kidney function. Additionally, apples contain a variety of other beneficial compounds, including vitamin C, which acts as an antioxidant to protect the cells, including those of the kidneys, from damage caused by free radicals. This vitamin also supports the immune system, aids in the absorption of iron, and promotes healthy skin and tissue repair. Consuming red apples can thus be part of a proactive approach to not only support kidney function but also bolster overall wellness. 2. Blueberries. Blueberries are celebrated for their high antioxidant content, particularly anthocyanins, which give them their characteristic blue color. These antioxidants are vital in combating inflammation and oxidative stress, both of which can damage the kidneys over time. Regular consumption of blueberries can help protect the kidneys from damage while boosting your overall health with a minimal calorie intake. Furthermore, blueberries are also a rich source of vitamin C and fiber, which contribute to their health-promoting properties. The fiber content helps in maintaining a healthy digestive system and contributes to cardiovascular health by helping to regulate cholesterol levels. Vitamin C, apart from its antioxidant role, helps in the formation of collagen, aids in the absorption of iron, and strengthens the body's immune system. Including blueberries in your diet is an excellent way to enjoy a sweet treat while supporting kidney health and other vital body functions. 3. Cabbage. Cabbage is another kidney-friendly superstar. It's packed with phytonutrients, which may help combat harmful inflammation and reduce blood pressure to factors critical in kidney disease management. Its low potassium content also makes it an excellent choice for those needing to manage their potassium levels without sacrificing vital nutrients. In addition to its kidney-friendly attributes, cabbage is a versatile and nutrient-dense vegetable that provides a significant amount of vitamin K and vitamin C. Vitamin K is essential for bone health and proper blood clotting, while vitamin C supports the immune system and acts as an antioxidant. By incorporating cabbage into your diet, you not only support your kidneys but also contribute to a strong immune system and robust skeletal health. 4. Fatty fish. Omega-3s also play a role in lowering blood pressure and improving heart health, which are beneficial for maintaining optimal kidney function. Besides their omega-3 content, fatty fish are also an excellent source of high-quality protein and vitamin D, essential nutrients for kidney health. Protein is vital for repairing and maintaining body tissues without exerting the kidneys, while vitamin D helps regulate kidney function and is crucial for bone health and immune function. Regular consumption of fatty fish can thus support not only the kidneys but also contribute to overall health and wellness. 5. Garlic. Garlic isn't just a flavor booster for meals, it's also packed with antioxidants and anti-inflammatory properties. Frequently asked questions. What foods should kidney patients avoid? Kidney patients should avoid foods high in sodium, potassium, and phosphorus. This includes processed foods, certain dairy products, and some legumes. Additionally, kidney patients should be cautious with their intake of nuts and seeds, which are typically high in phosphorus and potassium. Dark-colored colas should also be avoided, as they often contain high levels of phosphate additives, which can exacerbate kidney problems. What damages the kidneys the most? High blood pressure and diabetes are the leading causes of kidney damage. Controlling these conditions through diet, exercise, and medication can significantly reduce kidney disease progression. In addition to high blood pressure and diabetes, long-term use of certain medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, and some antibiotics can cause kidney damage. These substances can interfere with the normal function of the kidneys, leading to decreased kidney efficiency and, over time, chronic kidney disease. Being mindful of medication intake and regularly consulting with healthcare professionals can help mitigate these risks. What not to drink if you have kidney problems? Avoid beverages with added sugars, such as sodas and certain fruit juices, as well as excessive alcohol consumption. Patients with kidney issues should also steer clear of energy drinks and some types of bottled iced teas, which can contain high levels of caffeine and other chemicals that may stress the kidneys. Additionally, these drinks often include phosphates and other additives designed to enhance flavor and shelf life, but which can be detrimental to kidney health if consumed in large quantities. Making informed choices about what to drink can play a significant role in managing kidney health effectively. Can drinking too much water overwork your kidneys? While staying hydrated is crucial, overconsumption of water is rarely a problem for healthy kidneys. However, in certain kidney conditions, excessive water intake can be harmful. For individuals with conditions such as polycystic kidney disease or those in later stages of chronic kidney disease, the kidneys may not be able to properly manage large volumes of fluid. This can lead to a dangerous condition known as water intoxication or hyponatremia, where the sodium levels in the blood become dangerously low. It's important for people with kidney issues to monitor their fluid intake according to medical advice to maintain the right balance in their body's fluids. What color is your pee if you have kidney disease? Kidney disease can cause changes in urine color, which can range from deep yellow to brown. However, many factors affect urine color, so it's essential to consult a healthcare provider for accurate diagnosis. Additionally, the presence of blood in the urine, known as hematuria, can give it a pink, red, or cola-colored appearance. Any change in the usual color of your urine, especially if it is persistent, should prompt a consultation with a healthcare professional to ensure that any underlying issues are promptly addressed. If you found this video helpful, please like, subscribe, and turn on notifications to not miss our future health tips. Share your thoughts and questions in the comments below. We love hearing from you. For more healthy living tips and resources, check the link in our video description. Remember, taking small steps towards a healthier diet can make a significant difference in your kidney health and overall well-being. Thank you for watching.